You don't feel it. There's no pain, no warning signal, no obvious sign. But right now, if you're living with chronic stress, your heart is being damaged. Slowly. Quietly. And most people don't find out until it's serious. Today, I'm going to show you exactly what stress does to your heart, step by step, and the 3 changes that stop it. Let's start with what actually happens in your body the moment you feel stressed. Your brain detects a threat, a work deadline, an argument, financial pressure, even just checking your phone. It doesn't matter if the threat is real or imagined. Your brain reacts the same way. It triggers your adrenal glands to release 2 hormones, adrenaline and cortisol. Adrenaline acts in seconds. Your heart rate jumps, your blood pressure spikes, your blood vessels constrict. Your body is preparing to fight or run. This is the fight or flight response. It was designed for short bursts, a predator, a physical danger that lasts seconds or minutes. Your body handles it fine. The problem is what happens when this response never turns off. Chronic stress means your body is running this emergency response for hours, days, weeks, months, and this is where the damage begins. First, your blood pressure. Every stress response spikes your blood pressure. One spike is harmless, but hundreds of spikes every day, from emails, traffic, deadlines, arguments, slowly damage the inner lining of your arteries. This lining is called the endothelium. Once it's damaged, it becomes rough instead of smooth. And rough arterial walls attract cholesterol deposits. This is how plaques form. This is the beginning of heart disease. Second, cortisol and inflammation. Cortisol is supposed to be a short-term hormone, but under chronic stress, cortisol stays elevated for long periods. Elevated cortisol causes systemic inflammation. Your immune system starts attacking your own tissues. Inflamed arteries become narrower and stiffer. Your heart has to work harder to push blood through them. Over years, this leads to heart failure. Third, your heart rhythm. Chronic stress disrupts the electrical signals that control your heartbeat. This can cause arrhythmia, an irregular heartbeat. In mild cases, it feels like a flutter in your chest. In severe cases, it can trigger a heart attack, even in people who have no other risk factors. And this is where it gets really serious. Research shows that people with high chronic stress have a 40 to 60% higher risk of heart attack and stroke compared to people with low stress, even when controlling for diet, exercise, and sleep. Stress alone is an independent risk factor for heart disease. It's as dangerous as smoking half a pack of cigarettes a day. Most people know about cholesterol and diet. Almost nobody talks about stress as a direct cause of heart damage, but the science is clear. So what actually protects your heart from stress? Fix number 1, the physiological sigh. This is the fastest proven way to activate your parasympathetic nervous system, the opposite of fight or flight. Take a double inhale through your nose, 2 quick inhales, then a long, slow exhale through your mouth. Do this twice. Your heart rate drops within 30 seconds. Cortisol begins to lower. This works faster than any medication for acute stress, and you can do it anywhere. Fix number 2, Zone 2 cardio. This means low-intensity, steady movement, walking, slow cycling, easy swimming, for 20 to 30 minutes, 3 to 4 times a week. Zone 2 cardio directly lowers resting cortisol levels, reduces baseline blood pressure, and strengthens the heart muscle itself. It is the single most researched intervention for cardiovascular health and stress reduction combined. Fix number 3, social connection. This sounds soft, but the research is hard. People with strong social connections have significantly lower cortisol levels, lower blood pressure, and 50% lower risk of heart disease than socially isolated people. A 10-minute, genuine conversation with someone you trust lowers cortisol more effectively than most relaxation techniques. Your nervous system literally co-regulates with other humans. To recap, chronic stress damages your heart through 3 pathways: blood pressure spikes that scar your arteries, elevated cortisol that causes inflammation, and disrupted electrical signals that cause arrhythmia. The fixes: the physiological sigh for immediate relief, Zone 2 cardio for long-term protection, and genuine social connection, which research shows is as powerful as any medication. Subscribe. New video every week. In our next video, we're exploring something that might surprise you: how your gut controls your brain. Subscribe so you don't miss it.